our channel. Let us continue part 3 of psychiatry with anxiety disorder. So anxiety is nothing but it's just experience of fear or worry towards something. So that is anxiety disorder. It is divided into main three types as panic disorder, phobia, generalized anxiety disorder. According to name, you can see panic means you're getting panic to something, and phobia means you're specific phobia for specific thing you're getting anxiety or fear. Generalized anxiety is like for general conditions, for day-to-day activities also if you get anxiety, that is generalized anxiety. Selective mutism already discussed in childhood disorders. You can remember this, like selectively the child suddenly becomes mute, that they'll not talk for that specific condition, that is selective mutism. Now let us see each of this in a somewhat detail. Panic disorder is any disorder which is for greater than 1 month, and it is mainly lasting for 10 minutes with any of the four of the following features, like you have palpitations when you see something, you get recurrent attack of palpitation. Paresthesia means like tingling sensation. Depersonalization, derealization already discussed. Abdominal pain, nausea, intense fear of dying, intense fear of losing control, lightheadedness, chest pain, chills, choking, sweating, shaking. So all this you can see are the features of like fear. So this is also strong genetic component involved, which will lead to increased risk of suicide in case of panic disorder. Important is timeline greater than 1 month. And panic disorder can be treated first line by SSRIs and CBT. Second line is benzodiazepines, but benzodiazepines can be given only in acute setting. Now coming to phobias. Phobias are like you feel anxiety or fearful for specific situation. For example, phobias are divided into social anxiety and agoraphobia. Social anxiety disorder means you get fear in public speaking, using public restroom. So whenever you see public you get fear, so that is social anxiety. Here also again treatment is CBT and SSRIs, also venlafaxine, which is SNRI, right? So sometimes there's also fear to public speaking. All these conditions we can use beta blockers and benzodiazepines if needed. One more thing, phobias timeline is very important for 6 months. So phobias for 6 months, panic disorders for 1 month. And next, agoraphobia. It is like a fear or avoidance while facing or anticipating in public transportation, closed spaces, lines, crowds, or when you are outside from the home alone. All these are agoraphobia. So here also treatment is CBT and SSRI. Next coming to generalized anxiety. As I said, generalized means for general day-to-day activities also you get anxiety. That is generalized anxiety, and it is timeline is 6 months, which is important. And the mnemonic is crimes. Crimes means there's concentration problems, restlessness, irritability, muscle tension, fatigue, and also there's low energy, E for energy, and there are also sleep disturbances. So crimes is a mnemonic for generalized anxiety disorder. Treatment is SSRI, SNRI first treatment, but other like buspirone, TCS, benzodiazepines are second line. So again timeline is very important. 6 months for phobia, 6 months for generalized anxiety disorders, panic disorders for 1 month. Next coming to obsessive compulsive disorder. Here like there's a continuous feeling like you need to hand your wash your hand, wash your hand. You're getting that feeling again and again in your brain, so that you go and do that work again and again. When you do that only you feel satisfied. So that is a repetitive performance of some actions, that is called as obsessive compulsive disorder. Obsession means you're getting in your brain signal, do it. Compulsive means only if you do then you feel happy. So that kind of behavior which is continuation, which is in continuation repetitive manner. So for this treatment is CBT and SSRIs. Very important thing, it is associated with Tourette syndrome. If you remember, OCD and also ADHD both are related to Tourette syndrome. And this obsessive compulsive disorder is also associated with schizophrenia, bipolar disorder, and some eating disorders. Eating disorder we are going to discuss in upcoming videos. Next coming to body dysmorphic disorder. In the name itself you can see body dysmorphic means the person is more worried about the body, like whether their nose is correct or not, whether their hairstyle is correct or not. So they're more thinking about their body. So for example, checking mirror many times, excessive grooming, all these are example of this. It is common in eating disorders. Treatment again CBT SSRIs. So all this treatment for panic disorders, for phobias, for generalized anxiety, for obsessive compulsive, for all this, the main first line treatment is SSRIs, which are antidepressants. Okay. Timelines are again important. Let us revise. Panic disorders greater than 1 month. Phobias, generalized anxiety 6 months. Trichotillomania in the diagram you can see it is like a feeling to pull out the hair from head, so that you remove lot of hair and you can see some patches like this, but it is not completely bald. You see only patches like this. Especially in the scalp area, this kind of people try to pull out hair from the scalp. So this is highest since childhood, but in all ages you can see. Here the treatment is psychotherapy. Now coming to trauma and stress related disorder. Because of trauma, what happens? Adjustment disorder is like if someone get divorced or if someone get illness, they need to adjust to that new stress kind of situation. That is called adjustment disorder. Here again timeline is very important. It is less than 6 months. So phobia for 6 months and generalized anxiety disorder for 6 months, but adjustment is less than 6. Panic is greater than 1 month. Okay. So here the treatment is again you can give CBT and antidepressant. Anxiolytics are also given. One more thing is, if this adjustment disorder doesn't regress by 6 months, then it may continue to further major depressive disorder or generalized anxiety disorder in future. So we need to reevaluate these patients once after adjustment disorder gets reduced. Next, coming to post traumatic stress disorder, and the name itself you can see after some trauma or stress what is happening, that is a this condition. Example like after serious injury, after sexual assault, all these conditions, what happens is you can remember this by mnemonic HARD, that is there is hyper arousal, there is avoidance of associated stimuli, there is re-experiencing again the same situation, and D for distress. So HARD is a mnemonic for post traumatic stress disorder, whereas crimes is a mnemonic for generalized anxiety disorder. And the timeline is very important. Greater than 1 month is the timeline for post traumatic stress disorder. Here the treatment can be again same SSRIs, CBT and SNRIs like venlafaxine. Important thing is prazosin. Prazosin can reduce nightmares. Prazosin also can cause orthostatic hypotension, which is a side effect for prazosin. Next, coming to acute stress disorder, that is lasting from 3 days to 1 month, that is less than 1 month. So less than 1 month is acute stress disorder, greater than 1 month is PTSD, greater than 1 month is panic disorder. So greater than 1 month you have two disorders, post traumatic stress disorder, panic disorder, and less than 1 month is acute stress disorder. How to remember this is, whenever you see the word disorder at the end, all those are related to 1 month. Acute stress disorder less than 1 month, post traumatic greater than 1 month, panic disorder greater than 1 month, but adjustment disorder is only the one which is less than 6 months. Remaining all are phobia 6 months, general anxiety disorder 6 months. So this is a very important timeline graph for different kinds of diseases. So the first one is, you can see sleep disorders, that is narcolepsy, which is for greater than 3 months. Childhood disorders, selective mutism, separation anxiety greater than 1 month. ADHD, specific learning, oppositional deficient greater than 6 months. Tic disorder, disruptive mood dysregulation greater than 1 year. Anxiety disorders, panic greater than 1 month, acute stress less than 1 month, post traumatic stress greater than 1 month, phobias, generalized anxiety greater than 6 months, adjustment disorder less than 6 months. Psychotic, we already know, delusion greater than 1 month, brief psychotic less than 1 month, schizophrenia 1 to 6 months, schizophrenia greater than 6 months. So this is schizophreniform less than 6 months, schizophrenia greater than 6 months. Next, come into mood disorders, major depressive disorder greater than 2 weeks, manic less than greater than 1 week, dysthymic cyclothymic for 2 years. So these are the different timelines which we need to remember, because this is used to differentiate one diagnosis from other according to the timeline. Of course we also see symptoms, but timeline is very important to diagnose this kind of psychiatric disorders. Now let us discuss about personality disorders. So personality disorders are divided into three types: cluster A, cluster B, cluster C. Cluster A disorders are like a weird kind of diseases, and cluster B are wild type, and cluster C are worried or anxious, fearful type. So let us see what disorders are present in each cluster. The first one is cluster A. Cluster A contains first one paranoid, schizoid, schizotypal. Paranoid is suspicious type, vigilant type. Schizoid is someone who want to live alone, that is schizoid. Schizotypal is who are believing on superstitious and they think magical thinking, all those things. And paranoid, important thing is ego defense, which is associated with its projection. Projection, if you remember, an ego defense where someone intentionally throws some kind of uh, reason on their opposite people, so they project the reason, that is a projection, ego defense related to paranoid. Next, coming to cluster B, which is antisocial. Antisocial is like they do criminal things, bad, involuntary, impulsivity, manipulative things. It is most common in males. Actually, this disease can be diagnosed only after 18 because before 18, the same, this is conduct disorder. If you remember conduct disorder in children, they're having disruptive behavior and they act aggressive way with children and animals, that is conduct disorder. So conduct disorder when adults have this after 18 years, that is called antisocial personality disorder. Next, borderline personality disorder is associated with splitting ego defense, if you remember splitting, which is a mature ego defense. So that is related to this. Here the patients have unstable mood and interpersonal relationship. They have fear of abandonment, impulsivity, suicidality. So they are, that's why called borderline. Next, histrionic. Histrionic are the people who want to be the center of attraction for everything. So they are attention seeking, dramatic speech, emotional expression, and they may use physical experience, appearance to draw attention. Narcissistic is like they want to rule someone, so they are grandiosity, they feel they are the great, and a sense of entitlement. They lack empathy, require excessive admiration because they feel always great, so they also want more admiration, and they always want to be best. And a reaction to criticism with rage or defensiveness. So they're having lot of self-esteem, that is narcissistic. Next, cluster C. Cluster C treat as avoidant, obsessive, compulsive, dependent. Avoidant, in the name itself, see they avoid, they're hypersensitive to rejection and criticism. So they are socially inhibited. But one thing is avoidant want to have relationship with other, but schizoid are completely different. They just want to be alone. They don't want any relationship. But avoidant, they want relationship, but just they are avoiding. Like they feel anxious to go into relationship, but they want it. Obsessive compulsive, that is a very important thing here now to discuss, because there is obsessive compulsive personality disorder. Obsessive compulsive personality disorder and obsessive compulsive disorder are completely different. Obsessive compulsive disorder is actually ego dystonic. Like ego dystonic means we don't like it. Who likes to wash hands more times, who likes to be like doing something repetitively, they don't like it, so this is ego dystonic. But obsessive compulsive personality disorder is egosyntonic, that is someone loves to be like this because it is a preoccupation with perfection, to control something, to do something in a perfection, to do it in a like a focus way, so that is a good thing. So obsessive compulsive is egosyntonic, which is very important to differentiate this both. Next, dependent. Dependent, in the name itself you can see someone who is dependent on ideas or always dependent, excessive need for support, they have low confidence. So patients often get stuck in abusive relationship because of this dependent personality disorder. Now let us come to malingering. These are somatic symptom disorders. So malingering is like someone they wantedly want the disease because they're going to get some secondary benefits. So you can see as the secondary benefit gain. This is most commonly seen in male patients who are malingering. They have some secondary external gain, like they want to avoid work or get some compensation, as now they got disease, so they can get some compensation. So this kind of behavior is malingering. Whereas factitious disorder is someone who wantedly gets the disease so that they get some pathetic situation. You can see they get some primary gain, like someone they'll get the medical attention and all the people care them because they are now in hospital. So this kind of feeling is factitious disorder. And next, factitious disorder impose on self. Actually, we discuss this, like they themselves get the disease. For example, a hospital nurse will inject some kind of bacteria to herself so that she can get the disease. So all this kind, it is most common in females and healthcare workers. Next, coming to factitious disorder imposed on another. This is also called Munchausen syndrome by proxy. The before one, this is called Munchausen syndrome. By proxy means they wantedly make their child or someone elderly uh, deceased, so that they will say some, they lie about the child syndrome and they bring sympathy to the child or some elderly. This is called factitious disorder imposed on other. Now coming to somatic symptom and related disorders. Here the risk factor is female, low status, low education. Actually the stress is only implicated, or it is represented as body pains or abdominal pain, fatigue, like that is somatic syndrome. It can't be actually explained by some medical diseases. So somatic syndrome disorder is greater than 6 months. The people come to the same physician again and again. They do all the checkups, but everything is normal. Because of stress, they show bodily symptoms. This is called somatic symptom disorder. Next, conversion. In the name itself, you can see they convert the stress into neurological symptom disorder, like paralysis, blindness, mutism. So because of some stress, they are getting paralysis, blindness, mutism. Next, you can see la belle difference, indifference in conversion disorders. That is, it is more common in female adolescents and young adults. That is, they show indifferent towards symptoms. You can see acute stressor. Patient may be aware of but indifferent towards symptom. That is conversion disorder. Next, coming to illness anxiety disorder, it is also for 6 months. Here the patient actually don't have any disease, but they always think they have some disease, and they come to doctor many times and do many tests, many medical evaluations. So that's why this is also called undiagnosed illness, because there's no illness but they think they have illness. Now coming to malingering factious disorder, somatic symptom. Let us differentiate three of them. The symptoms are intentional here in the malingering, because they themselves get the disease intentionally. Even though actually sometimes they might don't have disease, but they lie they have some disease. That is malingering. Factitious disorder also intentionally they themselves get the disease, whereas in somatic they are unconscious. They are getting disease unconsciously. They don't do it by self, right? Next, motivation is intentional here in malingering, like they themselves got the disease. Even the symptoms may be intentional. I mean, the disease is not real here. But in factitious disorder, the motivation is unconscious, because now you got the disease, so the symptoms will be unconscious only. And somatic, both are unconscious, even motivation is unconscious. So by this we completed this. Next, somatic disorders. Next we'll continue with eating disorders and also theoretical model of change.